Everyone. Nadi Chikitsa or pulse diagnosis is the topic for today's session with Dr. Mahesh Krishnamurthy. Dr. Mahesh has over 20 years of experience in Nadi Pariksha or Ayurvedic pulse diagnosis. His work on root cause diagnosis and appropriate therapy has transformed lives of over 50,000 people. He has helped people who are in emotional distress, emotional trauma, and in relationship crisis. He is an award-winning physician who is going to join us from Bangalore, India. I am Amita from Nourish Doc, a platform for natural and holistic therapies. I am honored to introduce all of you to Dr. Mahesh. Welcome, Dr. Mahesh. Namaste.
Namaste.
So what we can get started, Dr. Mahesh?
Well, thank you so much, Amita, for inviting me onto this platform to share my work with the people and how that will benefit them. So primarily, I have put in a few slides here, and as you can see, the contents of the slide, we start with the purpose of diagnosis, and we go on to go all the way up to why we need a different kind of diagnosis now. So we have always had diagnosis from the time when we have known much before Socrates. We've always known diagnosis to exist. But something changed from the year 2000. When more technology started coming into the diagnostic world, people started losing their ability to diagnose. When I was a child and my father took me to a doctor for a stomach ache or maybe a fever, the doctor would examine and then prescribe a very small dose of medicine, or probably sometimes he would even ask me what I had for food, or did I snack something, was there indigestion. So there was a dialogue. So we had something called as a family doctor. So there was a concept and everything was smooth. So he was just a call away, or he was in the vicinity where we stayed, where we lived. But after 2020, when technology started coming in, time given per patient started shrinking. With the result, the connect between the doctor and the patient started shrinking and started eroding to an effect that the patient does not have time to express himself to the doctor and has to just listen to the doctor. And any questions asked by the patient is not answered. This is pretty much prevalent all over the world. So the traditional diagnosis that we've always had, which was also a part of the modern medical diagnostics, was the connect between the doctor and the patient. And moreover, the doctor, having spent enough time with the patient's family, would know what's happening with the patient. So there was a network between the doctor and the family. In the olden days, it was much different. We had a system of diagnosis where the patient needn't have to tell anything. And that's what we are going to talk about today. We are going to talk about the very method of diagnosis that was prevalent, that was functioning successfully, because we as a race have existed through the time. Had that diagnosis not been effective, we would have not survived. But we have, which means that the diagnosis does make a difference to our life.
Okay.
Can we move on?
Yeah, we move on. You're absolutely right. I mean, all these, there's so many technology apps that have come in and you lose the human touch, and you have this computer telling you, do this, do that. I mean, that's all of us are living in this space, which can be very, emotionally distraught, it can distort you. Anyway, please go ahead.
Absolutely right. In fact, I want to take you through a small experience which I had about 17 years ago. When we had our first child, our daughter, she was born with a hole in the heart. Now, how did we get to know that? We had a an aged pediatrician, very old, frail person, took his time to climb up the stairs, walked up to this baby. He warmed the stethoscope, put it on her chest, and he said, I hear a murmur. She has a hole in the heart. And he announced it and he just walked away. Now I ran behind him and I said, Doctor, how do we fix this? And he said, go meet the cardiologist. I
Mm.
said, okay. So, to our luck, my wife was working for a cardiologist before our child was born. So, we reached out to this dashing 40-year-old man who is very busy through all the cardiac surgeries and consultations. Well, we
Yeah.
had preferential appointment because we knew him personally. And then he puts the stethoscope and he says, I don't see anything. I don't hear anything. And then he said, let's do an ultrasound. So we go to the ultrasound machine and he himself puts the ultrasound, the probe on this small child's
Yeah.
chest. And he says, oh my God, which doctor was able to tell without putting the stethoscope? What an amazing man, were the very words this cardiac surgeon mentioned.
Hmm.
So that was a clear divide between the older generation of doctors who actually understood medicine and the
Yeah.
new age doctors who practice medicine in an entirely different way. And that brings the new generation into a space where it's medication and the medication for different kinds of symptoms. So as a person, as a lay person, we have very limited understanding of what I have to do to take care of my body.
That's right. That's right.
So that's the whole crux of any traditional medicine system, is that the person who is receiving the treatment is educated on how they have to take care of the body. We are simply assisting as
Mm.
physicians or as healers. We are simply assisting the person, but the person himself is in charge of the body. I'm in charge of my body, and a physician will only assist my healing. That's the fundamental law under which traditional healing works. Now, when we look into an investigative procedure, now the whole purpose of an investigative procedure is to identify the root cause of the illness, which means that if I have a itch on my skin, I have to find out what is the root cause of this itch even before I medicate the skin.
Mm.
The practitioner here, I'm talking about traditional medicine, listens to the body and the manas. Manas meaning the plane of existence where thinking happens. I think, we all think, but how does thinking happen? Where does it happen? When I ask this question, people just point to the head. But I have spoken to people who are in coma, and even they can tear up when you speak to them emotionally.
Yeah.
Now, where are they thinking? How are they thinking? So, thinking happens in a plane of awareness we call as the manas. Now, in order to locate the malfunction in the body, in the manas, and emotions and feelings, the investigation is done. So, we are looking into the body, we're looking into the emotions, feelings, thoughts, beliefs, behavior. All these six factors is what we look into. And there is a valid reason for us to look into this whole vast area. There is a valid reason. I will explain to you in a moment. And only when we have gone into the depth of these six factors that we will be able to solve the problem or heal the person in the quickest and the smartest way. And that remedy comes from two sides. On one side, we heal the root cause, or rather remedy the root cause, and on the other side, we work with the symptom. And this is pretty much how every kind of medicine has functioned, whether it is homeopathy, Ayurveda. Even modern medical doctors in the olden days
Yeah.
functioned this way. They did. Can we move on to the next slide?
Sure, please. Yes.
Yeah. So diagnosis involves the below aspects of the client and the environment they live in. You know, in Ayurveda, we say Desha Kala, which means that the place where you live in and the season that you're living in.
Hmm.
We see that as seasons change, we catch a cold, we get a flu, right? And the
Yeah.
reason is not because the season is changing. The reason is because you did not pay attention to the changes in the environment. So to give you an example, in Bangalore, we have rainy season. So
Hmm.
we are at the cusp of the rainy season and autumn. This is the cusp. So in this season, we are not supposed to have anything that's oily. We are not supposed to have anything that's difficult to digest. But how many doctors really educate the patients to stay healthy? In this time of coronavirus,
Hmm.
the safest way to stay healthy is to monitor your diet. When you fall ill, you have medications to take over.
Yes. Dr. Mahesh, hello. I think your camera froze. Can you check,
Your
please?
physical body.
Dr. Mahesh, your video froze for some reason. Can you hear me?
The whole, oops, I can't hear you loud and
Okay.
clear.
We just lost last 30 seconds of what you said, if you don't mind repeating.
Oh, sure. So
Okay.
I was coming to say that the diagnosis involves the aspects of the client and the environment, the place they live in. So
Yeah.
here in Bangalore, we have rainy season. So here we are at the cusp of the rainy season and autumn. So when we are in this cusp, this is a time when we must not consume anything that's oily, anything that's difficult to digest. We have to keep our digestion light, and that's the way you stay healthy. And while the pandemic is on, that's the major advice that people need is to eat right. That's the most important thing. Now, here, there are four factors which I have mentioned here: the person, manas, emotions and feelings, and environment. The diagnosis involves these four parameters. By the person, we mean personality, which means the attitude. So we all carry our thoughts, feelings, emotions, beliefs. We have our perceptions, our choices, our judgments, our desires, and then we have our attitudes, our attributes, and all of these together form the personality. So what you eat, what you consume in the body is not only the physical food. What you see contributes to your body, what you hear contributes to your body, and what you sense contributes to your body. All these three as well, which is why looking into the manas becomes so very important. And this manas is where we have all our thoughts, feelings, beliefs, behavior, and all of these paraphernalia of what we cannot see. So the physical body, physical frame that you are seeing is just about 25% of who I am. The 75% is simply invisible. It won't be visible even with an X-ray machine, so to say. So the emotions and feelings play a big role in how healthy a person is. And the environment, of course. That is the time and the weather and the place we are living in. So in Bangalore, for example, we have a lot of influx of people from the northern part of India, from Delhi, from Dehradun, and all these places who come in. Even a lot of people from US and UK, all of them coming here. But they do not know what they must eat. We are 3,000 feet above sea level. You eat anything which is cooked on a pan, it is bound to increase dryness in your body. As simple as that. So every place, for example, US is a big continent. So what you eat in California cannot be the same diet for a person who is staying in New Jersey. That's because they're two different environments. So
Yeah.
California is like Bangalore, and New Jersey is a very cold place. It's icy. You have snowfall in winter. So the dietary preferences between these two places is so vast. So you cannot tell someone to have a diet which I prescribe sitting here. I must know what the temperate environment of California is, what is the environment in New Jersey is, so that I can suggest an appropriate diet, and even how the body behaves, right? And
Yeah.
so, while doing this diagnosis, taking all these parameters becomes absolutely important, which today is hardly prevalent.
We are all, conventional, I mean, generally programmed, I should say that, looking at the physical body and not ignoring the emotions. The emotions is completely ignored, when, or the feelings for that matter. And this is and you're absolutely right, because if you can take all the medication, conventional medication or anything, but if you don't fix how you're feeling, you're not going to feel better, or you're not going to feel whatever you're supposed to feel, right? So
Right.
this so I think what you're saying is completely makes sense. And look at what is happening now in COVID. So many mental health issues, so many emotional trauma is going on, even though the physical body might be fine, but the
Good.
emotional is completely gone. Not hasn't been a straight line, I should say that.
Absolutely. Absolutely.
Should we move
Can
on?
we move on?
Yes.
Yeah. So here I have a differential chart here where I'm trying to explain what the diagnosis is like. So let's look at modern diagnosis. With modern diagnosis, it's more like your Toyota car. It's the most common car apart from the Honda company cars in the US. Now you look like you have a Toyota car. Your body is like this. Now that's how they treat you. Now diagnostic centers are available in every hospital you go to, and these are machine diagnoses. But then that's not enough. Now the diagnosis is generic in its nature and sometimes leans on statistical studies, which means that your blood pressure has to be 120 by 80. My blood pressure is 100 by 60 all the time. I had a time when my blood pressure shot up to 110 by 60, and I had a headache. I told the doctor my blood pressure is high, and they checked it and they said, you're 110 by 60, you're normal. I said, it's not normal for me. For me, 110 is high, and they laughed at me. So I understand what my blood pressure reading is. Now, modern medical diagnosis is driven by technology, which means that human interaction is limited, and then every organ is diagnosed independently. Now, this is a big thing that we need to look at. When we look at traditional diagnosis, now your body is unique. So when I'm diagnosing you, I'm diagnosing you as an entire personality who is a physical frame, your attitude, your attributes, your behavior, and all of it. And then all these diagnoses are available in every native country. You have some kind of diagnosis available in New Zealand, in Australia, in India, you go to Sri Lanka, even in the US, you have the native Indians who might have their own form of diagnosis. Now, diagnosis is accurate and it comprises the whole being, and every diagnosis is individualized, which means that if two people come with the same symptom, the cause of the symptom could be entirely different. So, which is why the diagnosis is individualized. And there's a human touch. When I work with people, when I diagnose people, the moment I feel the pulse, there is a shift in their consciousness. There is a certain amount of confidence that they get. The touch is extremely powerful. It is soothing. We all know that. Mothers know that more than anyone else. And the holistic diagnosis, which means the wholesome diagnosis, which includes the person, the manners, emotions, feelings, and environment, is the repository of any kind of traditional diagnosis. Now, coming back to the machine diagnosis, which I told you isn't enough, and that it sometimes leans on statistical studies. I would want to share one particular experience. There was a senior radiologist. He was a super specialty radiologist in the United States of America. Now, he had a block in the heart, and his son is a cardiologist. Now, this super specialty radiologist goes through a cardiac procedure and a bypass surgery to correct his system. Well, that was a surgery which was needed. But post operative, post surgery therapy was something which was needed. And the cardiologist, who is a son, recommends certain medications. So this senior has been a doctor for so many years. He looked at the medicine and said, I'm not going to be taking this. And he said, my liver will get damaged if I take this medicine. So the cardiologist said, let me refer you to the hepatologist. And he said, no, I don't want this. So the cardiologist called me and he said, Dr. Mahesh, can you please come? My father needs to see you. And then he was on Ayurvedic medication for post-operative therapy. And that's what healed him. That is modern medicine for you. Now, modern medicine was never written like this, but unfortunate that it's been practiced this way today. Can we move on? Now, I just mentioned that in the beginning that every symptom has a root cause. Now, let us look at what is a root cause. Now, the root cause of every symptom begins years before the symptom actually manifests. For example, diabetes the body starts warning you at least 5 to 7 years before the symptom of diabetes actually manifests. If you have a migraine, your body starts warning you at least 3 years before the migraine actually sets in. Any symptom for that matter, give it a name, any symptom for that matter, the warnings come much before. I remember so many cases where I've told people that pay heed to your body, and your body is warning you all the time. So set the things right, set the system right. I have a question for the audience. I have a very simple question. This is the question that you can ask yourself. Do you need the body, or does the body need you? There's a fundamental question you need to ask. Your body simply does not mind producing a disease. It simply does not mind. It does not mind. The body simply doesn't care, just wilting away, just deteriorating. But that's the only body you have. So you must care about the body. It's only you who can do it. No doctor can do it. If you take pills, look at a pill and see whether the pill has eyes, nose, mouth. Does the pill know where is your head and where is your foot? It doesn't. It just goes in and does what it has been programmed to do, which means that there are chemicals in it which work in a specific way. So what we have to do is to prevent the body from coming to the stage of treatment. When you're healthy, you need substances, or what we call as rasayana, which means these are nourishing ingredients which we take. But when you're ill, you have medication. So medication must not become the order of the day. You must not take medication to breathe. Your life should not become a prescription. So root cause can be a thought, a feeling, an emotion, a trauma, a belief. I have a particular case here which comes to my memory. There was this lady, her son brought his mother to me, and this lady was having erratic blood sugar levels. It would shoot up to 450 in Indian readings. And the doctors simply didn't know how to manage that blood sugar. Whatever medications they gave, their sugar levels were simply high. It wouldn't come down. And they didn't know what made the sugar levels come down so that they could again monitor the dose of insulin that she was taking. When we brought her to me, I started talking to her. After doing a diagnosis, I understood that she had a lot of anger. So I started talking to her and asked her, What is your anger all about? And she mentioned, my my brother-in-law, he took away all the assets. He took away all our assets, and that's what has happened. That's the reason why I'm so angry. So then I started asking her what was it all about, and that set her off, and she started getting so angry. And before the consultation, the son had got a blood sugar check done, and he had found the blood sugar levels were absolutely normal. But after the appointment, I asked him to go and get a blood sugar test done, and we found the levels were 450 plus. Emotions can trigger symptoms in the body, and they do, because we are emotional beings. If you have pets, you'll know that these pets do take over illnesses from you. I have heard people tell me how pets take fevers from you, how pets take disorders, diseases from you. The pets who get sick in their liver, sick, they get cancers, they get all kinds of symptoms that can take away a fever from you. All animals are emotional. Humans are the only ones who are emotional, and we have an intelligence that we can use. But the unfortunate thing about us is that we choose to misuse our intelligence. The intelligence. That's what we do, and that's the problem that we must address. We must not misuse our intelligence. There are four things we can do with our intelligence. We can use it, misuse it, abuse it, or invest our intelligence in anything that we do. And if we use, misuse, or abuse, how we use, misuse, or abuse will decide how our body and how our life will become. So the root cause in Ayurveda can be diagnosed much before the symptom actually manifests. For example, if you have a fatty liver disease, or a simple non-alcoholic fatty liver disease, can be diagnosed easily 6 to 8 months before it actually manifests. We have seen this. We see this all the time. When we diagnose a fatty liver disease and the client goes to get himself checked, and they come with a report, I don't have a fatty liver disease. They say it's manifesting. We know it's coming. And after a few weeks or a few months, they come back and they say, you were right. Now I have a fatty liver disease. So you don't have to actually go and get a diagnosis with an announcement saying that this is the disease that you have. You can stop it much before it actually manifests. And when you catch it early, it's usually much easier and simpler to reverse the symptom or reverse the condition that you have. But if it delays, the more the delay, the higher the rate of progression and more difficult the therapy. There are times when it becomes irreversible. At that time, you have to manage with medications. With medications, the symptom simply goes on aggravating. And you must work on the mind. This is very important.
Okay.
Yes,
So I
can
think the key is, you mentioned that you can tell about a disease, at least like a fatty liver disease, about a few months before. But I think
right.
it's up to the person, right? That if they are manifesting some of the whatever, I don't know what symptom, something, to seek consultation at that time, or at least to see someone, so that that can be properly diagnosed a few months before. Not diagnose is probably not the right word, but it can be at least looked at to, so that's the problem, is like, if I'm a layperson, and a few months before I'm having a little bit thing, and we, generally all of us don't take things so seriously to go see
Absolutely.
a physician. That's where the mindset is.
True, true, absolutely. But that's where the problem actually begins. We take
Yeah.
things for granted. We take things for granted. I mean, we eat, for example, a very simple question that people can ask themselves. I ask people, what is hunger? When I ask people what is hunger, and yeah, I have various kinds of answers. I have people who say, I can't explain. I said, if you can't explain, then you don't know what hunger is, right? Then I ask them, what makes you eat? They say, I feel hungry. I said, now tell me, what is the feeling that you have? So I actually did a research a few months ago I did a research and I circulated these questions to people. I got over 300 answers, and I inquired with people what is hunger and where do they feel it. So there was a figure, a human figure with different pointers saying that please point where you feel your hunger. You will be astonished. 80% of the people thought rumbling in your gut was hunger. 80%. They thought rumbling in the gut was hunger. They don't even know what hunger is. And just 5% actually felt hungry. Just 5%. The rest of them don't even feel hunger. Every day in and day out, I keep asking people when they come for consultations, I ask them, what is hunger? Where do you feel it? Because that becomes hunger is one of the biggest reasons. The ignorance about hunger is one of the largest reasons for many symptoms to manifest. So in Ayurveda, there are primarily three emotions that cause all symptoms. And these three are sorrow, fear, and anger. These are the three emotions that cause all problems. And we all carry a good measure of all these three emotions. And different times, different symptoms manifest. In traffic, anger manifests. You don't get your order, your sorrow manifests, and you have a fear of losing your job, fear manifests. So typically in this world, we have the chronology of events. For example, Ayurveda says is what it says is when desire does not get manifested, then you start experiencing these three emotions in sequence. The first we say when desire doesn't get manifested, kama shoka, which means that desire doesn't get manifested, you start feeling unhappy first. You're unhappy. You experience sorrow. So that, oh no, this didn't happen. I so much wanted this to happen. And then bhaya vayuhu. Then there is a fear. What if now everything that I want is for something else? We never stop at what we achieve. What you achieve is to achieve something bigger, something larger, something in the future. And so we start getting anxious. We start getting restless. We develop fear. And then krodhat pitamiti, which means then it turns into anger. And the anger increases because now you are angry that you're not getting what you thought you would get. So you are relating to a past thought, this is what I will get. You're not getting it, so you get angry. So these three emotions come in fair measure in all of us, and they create all the problems that we face in our day-to-day life. Symptoms like ulcerative colitis, your hyperacidity, your diabetes, your
Mhm.
blood pressure, or
Yeah.
liver cirrhosis, gallbladder stones, all of them come because of these three emotions
So these three emotions all of us carry all the time in
all the
today's day and
time,
age.
all the time. So we have to work with our body all the time. Now we come to the part to understand how this diagnosis is done. How do we diagnose all these factors? And this is where my work comes in. So my work is to help you understand what is happening in your body and how has it manifested. What are the kinds of thoughts, feelings, emotions, beliefs, behavior, perceptions, judgments? What are the things that you have been carrying within you that is causing the symptom? And this process is called Nadi Pariksha. So, this is the ancient method of diagnosis which has existed for thousands of years. And Nadi implies the pulse, which is the radial artery, and Pariksha means examination. So what happens here is we feel the vibration in the body. You just listen to the vibration, it conveys all the information that we need. And this is one of the most perfected forms of diagnosis even till date. There is no diagnosis, there's no prognosis in allopathy, in modern medicine, where you can tell, given the body's present condition, where it will take you in a few years. You cannot tell because the science has not been written to give that detail. There is no preventive medication in allopathy because the science was not written that way. Preventive medication helping the body recover without the symptom having manifested, all exists only in traditional medicine. And Ayurveda is is probably the leader of all these medicines. Now, Ayurveda does not mean that it's not traditional medicine. It's all the traditional knowledge which comes together to form the textual referenced book of Ayurveda, which are the Samhitas.
Okay.
Can we move further?
Sure.
So this is the most comprehensive method of diagnosis in which you get to know your thought patterns. Now, when I feel your pulse, I can tell you what your conscious thoughts are, what your analytical thoughts are like, and what kind of thoughts come into your dreams, in your sleep state. I can tell you all that. So this is possible in Nadi Pariksha. And we can also tell how they translate into physical symptoms. For example, anger creates migraine. This is most people wouldn't know. And fear leads to constipation. And sorrow creates symptoms like bronchitis, or you could have pneumonia, you have lung problems. This is what sorrow creates. I have an experience here to share because one of the feedback later in the slides, we have a person who got rid of his migraine, which existed for over 20 years. But I'm going to talk about another case here. I went to Mumbai, one of the suburbs of Mumbai, to diagnose a lady. They had called me there. I checked the pulse and I said that there is a certain fear that you have. It's like as if you're being blackmailed by a person. So is something like this happening? So this lady was asking me, is this person tall or short? Is he fair skinned? Is he dark skinned? Is he skinny? Or is he plump? She was just going on asking me these questions, and her husband just walked into the house and said, "Why don't you simply say yes?" All right. And then the doctor told me that she is getting admitted to the hospital every 15 days with symptoms of pneumonia. So I took her through the therapy to release the trauma that she was carrying. And in 15 days, she was all right. And 3 months later, the doctor messaged me. She sent me an email and she said, my mother is not visiting any hospital anymore. She is completely recovered. So the trauma of pneumonia was primarily caused because of the fear of being blackmailed, of the sorrow that she felt of being subjugated to this kind of trauma. So every symptom comes because of emotions, and this is something I have been seeing. It's not something that I'm just stating. This is what I have seen for 20 years that I have done Nadi Pariksha. Yes,
Okay.
I'm sorry.
Yeah, no, I was just going to make a comment that how many physicians are like yourself who understands how to do Nadi Pariksha in the right way and diagnosis in the right way, the way you have explained it. Because most of us are surrounded by, conventional way of diagnosis.
You're right. In fact, the sad truth is that Nadi Pariksha is not taught in the colleges where they study
Right.
Ayurveda. It's not taught. I went to the foothills of the Himalayas to learn Nadi Pariksha, and then my study progressed further where there was a Sanskrit scholar and aged octogenarian. I did his Nadi Pariksha and told him that he was having a prostate gland enlargement. And he said, I haven't seen anybody go so deep. And he gifted me a book which was published in 1886, in the year 1886. So I did research on that for 4 years, and that helped me upgrade my skill. And then I was teaching Nadi Pariksha in Hyderabad, and there was another person who came from Gujarat, and he told me, I have this book, I've read it, but I understood nothing. And he gave it to me. And that was the text of Ravana Nadi, which I still hold with me. And I've been researching that for over 10 years now. And that's brought us to what we are talking here on this slide, where we have Doot Nadi Pariksha, so the remote pulse diagnosis. I had just heard of it. I just heard of it when I was practicing Nadi Pariksha. I had absolutely no experience of it. But I was in Haryana. The government called me In fact, I was the first person in India to be called by the government to teach the government Ayurveda doctors the science of Nadi Pariksha. So I trained these government Ayurvedic doctors, and after doing that, after finishing the training, I came back to Bangalore. So one of the doctors, Dr. Yogesh Sharma, he called me and he said, I have this patient with me. I've done his Nadi Pariksha. Everything seems fine, but he complains of body ache. So can you tell me what could be the cause? So I told him, please send the chart. So he emailed the chart. I'm looking at my iPad. I'm looking at this chart. And then suddenly the information jumps on my face. Severe losses in real estate is the root cause of all his problems.
Mm.
Now, I have no way of knowing whether it's true or not, but I believe what is revealed to me. So I emailed the doctor saying that severe losses in real estate is the root cause of all his problems. And then he said, this is not Ayurveda. I cannot tell the patient that it's losses in real estate, it's causing your problems. I'm a doctor. So he told me, I'll do one thing. I'll put you on the loudspeaker at 2:30. I'll call him at 2:30. I'll put you on the loudspeaker. You tell the patient. I said, okay, for me, truth is truth. And then 2:30, the doctor puts me on loudspeaker and he says, here is the patient. Please go on. I told the patient, severe losses in real estate is the root cause of all your problems. And the patient asked the doctor, who told him this? So then the doctor asked the patient, is this true? He said, it's damn true, but I haven't told anyone. Now, who told him? And he doesn't even know me.
Yeah.
This is Doot Nadi Pariksha, which means that I feel my pulse and I focus on your forehead, and here my pulse will change.
Oh, so you look at my forehead through the video, right?
Right, right.
And you can tell what is manifesting in my thoughts or emotions or whatever, right? Is that?
Including your organs. I will also tell you what's happening in which organ.
Oh my God. That's
Yes.
pretty scary. That's very scary, but it's great. Oh, wow.
Yes, it's true. It's true. I've been doing that. In fact, one of my students who
Yeah.
is learning Nadi Pariksha now, she was the first person. So I didn't actually, to be honest with you, I didn't know that I had acquired this science. I didn't
Mhm.
practice it. I didn't practice it. So just about a month and a half ago, one of my students, who is in the US, she called me and she said, Dr. Mahesh, I want to do Nadi Pariksha service from you. I want to take a consultation. Now I said, you know what? I'm not sure if I can do it. And she said, no, I said, I can just give it a go, but I'm really not sure if I can do it because I hadn't practiced it. Who knew the pandemic was coming? So then we logged on to Zoom, and then I felt my pulse, and I told her what was happening in her life, and she said, and I took a feedback from her, and she said, well, here was Dr. Mahesh. I mean, he could feel my pulse and his pulse, and that started off this Doot Nadi Pariksha, which I started offering, and it's been a great service to people. They don't have to physically come, and it
Yeah.
has really shrunk the world of diagnosis, of Ayurvedic diagnosis. It's been a phenomenal opening for people who are in distress, and they
Mhm.
have received so much help because of this amazing science which was revealed to people. I mean, there are references, there are textual references for Doot Nadi Pariksha, which is the beautiful thing. So we have four things that I mainly look into. From the diagnosis perspective, I look into Nadi Pariksha. This is my fundamental
Mhm.
method of diagnosing. I don't look into the reports. I don't ask any questions before doing Nadi Pariksha. This is what Nadi Pariksha really is. So you don't have to tell me anything about yourself. If I didn't get it, you can add. So I do the diagnosis. I tell you what is happening in your organs and how they're manifested. What are your thoughts, your feelings, your emotions? All that can be just just displayed bare.
Mhm.
And based on that, the therapy happens. So Doot Nadi Pariksha and Nadi Pariksha are very similar. In fact, I record all the information in Sanskrit, the way the diagnosis is done. So which means that if I do your diagnosis, I have a record of your diagnosis to refer. So if you come back after a month, I can tell you this is how your diagnosis was last month, and we'll do a review, and this is how it will be this month. So we have everything documented. Now, based on the Nadi Pariksha, we go through the therapies. Now, Marma Chikitsa is one of the very strong therapies that we teach. Marma Chikitsa is a therapy which can restore organ vitality, which means that if you're sleepless, you do Marma Chikitsa on yourself, you can sleep like a baby. If you're constipated, you can do this therapy and you will be able to ease yourself. You have urinary incontinence, you can get well. My mother had a heart attack 3.5 years ago. I didn't take her to any hospital. We took her to a cardiologist. That's because my one of my brothers is not familiar with the medical science, so we had to take him into confidence. So we took my mother to a cardiologist, got her ECG done. We saw multiple attacks coming, and the doctor said, "Oh my God, her sugar is 380. She's diabetic." This is pretty much what happens when you get a heart attack. People tell you that you're diabetic, and if you go to a hospital with a person who had a heart attack, you will see these doctors actually giving them insulin to reduce their blood sugars, which is so in Ayurveda we don't do that. So I told the doctor she's having a heart attack, blood sugar will be high, and
Yeah.
then I treated her with Marma Chikitsa, made the medicines at home, and today she's 83 and perfectly fine. And the blood sugars are normal. We didn't treat the blood sugars. The blood sugars are required to heal the heart. This is what every traditional medicine practitioner will tell you.
That's
Right.
amazing. We have questions coming up, so we'll try to leave some time for the questions.
Sure.
Do you want to take the questions at the end or in between? It's
We
up
can
to you.
take the questions. We can take the questions and go forward.
Okay, so there's a question someone is asking, how many Vaidyas do remote Nadi Pariksha? Just told us what, I don't know what that means. Are you asking how many Vaidyas are doing remote Nadi Pariksha right now? Or is that, maybe that's the question. I don't, Dr. Mahesh, do you know? Like, you are the only one.
I'm sure I'm not the only one. There are a lot of very good Vaidyas who do not come into the limelight.
I see.
For me, it was about 13 years ago when I was sitting in my meditation. I got an inspiration that I have to give this knowledge away before I go, and that's how I've been teaching. But I'm
Yeah.
sure there are a lot of other people out there who do it, but who do not proclaim. I'm sure I might not be the only one.
Okay. Should we move on to the next one?
Sure.
Second. All right.
Right.
So
So we have certain trainings that we offer. This is a part of our outreach. We have to give away so that we can get new knowledge. So one of the fundamental things that we encourage people to know is to know your body. This is very, very important. You must know your body. Primary health care must happen at home. Don't just run to a doctor for every small symptom. I have people calling me. My daughter is coughing from morning. What do I do? I have this problem. I'm feeling giddy in the morning. What do I do? My stomach is feeling queasy. What do I do? So understand the fundamentals of how your body works according to nature. What is natural and what is not? How symptoms manifest. You must know the basics. It's absolutely important that you must know the basics. Don't go to Google, right? Don't go to Google because you go with a headache and then you will be told that you have a brain tumor. All right, you can. So I'm not telling it's wrong, but you will see the whole spectrum of manifestation. Where are you in this? If you have fear, you will be the worst case scenario. We'll have to deal with your fear before we deal with your headache.
yeah.
Right? So you have to. I remember there was a lady who told me one day. She came to me and she told me that my life is almost finished. I asked her, "What do you mean?" I mean, like, you look quite healthy. She said, "I have breast cancer." I said, "Oh, I'm so sorry. Did you get it diagnosed?" She said, "No." How did you make it out? How do you make out that you have breast cancer? She said, "I have a certain boil on my breast, and I went on Google and I searched and it said that I have breast cancer." Then I asked her questions and I said, "You know what? It looks like it's come because of indigestion." And I said, "Let me give you a small medicine to clear your system. And let's see in about a week's time. I'm sure you have that much time." And she took the medicine. A week later, she told me, that boil is gone. I said, "You see, you don't have blood cancer. Every person, please do not go to Google. It's important for you to understand the fundamentals of Ayurveda. This is absolutely necessary. And for those therapists and healers who want to learn Nadi Pariksha, who are not familiar with Ayurveda, the fundamentals of Ayurveda is a self-paced learning modules which we have put in, which is a 10-hour package of modules which you can purchase and go through the videos at your own pace. Now that becomes a very important study for you if you want to learn Nadi Pariksha. The reason why I'm saying this, that traditional healers and therapists must learn, is because I see most of the therapists are not conversant with the modern medical diagnosis. For example, MRI reports or X-ray reports. They're not, or your blood work. They're not very educated in reading those reports. At the same time, they do not have an alternate methodology to diagnose. It's very, very important for you to diagnose. Recently, last week, I was working with a healer who's been in the industry for 22 years. And when I did her Nadi Pariksha, I said, "You're losing your sleep." And she said, "Yes, but I don't know why." When I looked into her pulse, I said, "You're losing your sleep only because you've been giving too much of your time to the patients." This is very important for you to understand that your personal work is very important. Now we'll come to a few feedback that we have.
I've had issues with headaches.
We have only 8 minutes, so I can run some of the videos.
Yeah, they all have been truncated to just a few minutes. We will be able to accomplish
migraines.
Okay.
Probably for as long as I can remember. At the end of this first consultation, I was absolutely convinced that this will work. I would have such a major episode in the past that it was a debilitating experience, so I could not do the normal things I had.
All right, so we have...
so he's a person from Netherlands who contacted me.
I've had issues with...
Sorry. So, yeah, no, we have only a few minutes left, so that's why I want to give people a chance to ask questions from you. So, there were questions coming up. Could you please ask the questions? People were asking. I saw people raising hands and stuff like that. All right. So, if there are any more details, we have only 5 minutes left.
I have a question here. I'd like to take this question with Dr. A.K. Singh. And
just 1 second before we take the question. So I just want to say, if there are any other things we are not able to cover in this webinar, we have put our email here and our website, and some of the classes would be coming online through Narishak as well. All right, so now we can take questions. I'm going to stop sharing, and we can take the questions.
Right. So I have a question from Dr. A.K. Singh. Is that is it possible to do Nadi Pariksha without touching pulse? I think it's not possible. He's the principal of Ayurveda College last 20 years and practicing Ayurveda from 36 years. Dr. A.K. Singh, Doot Nadi Pariksha. You can find the reference in the book. It's called it's a book authored by Satyadev Vasishth, and the title of the book is Nadi Tattva Darshanam, where the Doot Nadi Pariksha is mentioned. So yes, it can be done. Of course, when we talk about Nadi Pariksha and Doot Nadi Pariksha, they are different. Nadi Pariksha, yes, we need to be face to face, where I need to feel your pulse. But in Doot Nadi Pariksha, I feel my pulse and focus on your forehead, and that's how I feel the pulse. So this is absolutely possible, and you have references. We have Sanskrit textual references for that. Yes.
So you have all the evidence as well that Doot Nadi Pariksha works, right? That's what you're saying, correct? Yes. In all the manuscripts and all that. One of the comments I want to make, we had a Dr. A.K. Singh, we had actually from US an Ayurveda practitioner, and she was talking about how she can look at anyone's face and try, based on the face, she can tell, whether anyone is having any medical issues or, but so I'm not a doctor, I'm just a facilitator. I'm just saying that she was talking about the similar kind of a concept. She wasn't calling it Doot Nadi Pariksha, but she was calling it facial analysis,
Yeah, Doot Nadi Pariksha is not the same as looking at a face. I just look at the forehead and I feel my pulse. So I record the pulse diagnosis, the reading on my pulse, which changes when I focus on your forehead, and I record that. And then based on that, I evaluate your physical condition. So But yes, I've also heard of people who just smell your clothes and tell you what disease you have. So there are different kinds of diagnoses out there. Yeah.
Yeah, but okay, so face analysis by Prakriti Pariksha can be done. And that's what she was talking about. That's what I'm saying, Dr. Ek is saying. She runs a college here in Florida, and she was talking about how looking at the facial analysis, she can kind of tell you on a very high level what's wrong with you, you know, overall what's happening. All right, any more comments? We have only 3 minutes left. Sorry, we just stop at the hour. We have only 1 hour for these sessions. If you know, we will be offering group workshops and other online programs and starting in November. So we will let everyone know when that happens. But any more, we have time for one more question. Okay. Any more comments? People in Zoom. So we have time for you know, one more question before we wrap up. Okay. All right. Well, any last comment? You have a minute if you want to say something. I'm sorry, you know, we just. Okay. All right. With that, we'd like to end this session. Thank you so much, Dr. Mahesh, for being with us. Namaste, and I hope the viewers found this you know, very useful, and let us know you know, feedback on our sessions. We run the sessions every week, and please share your feedback with us how we are doing. With that, I'd like to thank all of you for watching us. Thank you, Dr. Mahesh. Have a great weekend. Bye bye.